Everybody. Good morning, everybody. This is Susan Channa with Emory University. This morning, we are joined by Dr. Carlos Del Rio, who is our Distinguished Professor of Medicine, Epidemiology, and Global Health, and Executive Associate Dean of Emory's University School of Medicine at Grady Health System. Dr. Del Rio will be discussing his recommendations around the urgent actions that need to be taken to turn the tide on COVID-19's pandemic response. Also, as a reminder, please keep your systems on mute, as a number of our outlets like to use this for broadcast purposes. Also, as you have questions, go ahead and enter them into the chat function and we will take them immediately following Dr. Del Rio's briefing. Dr. Del Rio, I'll turn it to you.
Thank you, Susan, and thanks everybody for being on this. Let me connect this. I want to say first that as you are all aware, as we all realize, we are in a very difficult point in the pandemic right now in our country. We are having several days now with over 100,000 new infections per day. Yesterday we had over 150,000 infections. We're having over 1,000 deaths per day, and hospitalizations are going up. Last couple of days ago, we had over 60,000 people hospitalized. That's greater than we've ever had. So we are in a very difficult point in the pandemic. And unfortunately, we also have what I would describe as a leadership vacuum. There's nobody at any high level really talking about this, providing guidance, saying what to do. And that leadership vacuum is really simply allowing the pandemic to progress without anybody taking charge. I think it is an opportunity for the CDC to regain its leadership role and its standing. The CDC is the best agency available to take charge at this point in time and to really begin communicating on a clear way about where we are and what needs to be done. Because as we enter the holidays, as we enter these very challenging times, if we don't do that, we are going to have more pain and more suffering. The opportunity to communicate the leadership that needs to happen, it also needs to happen from community leaders. I would call on people at all levels, whether they're leaders in industry, leaders in county leaders, city leaders, state leaders, to really speak up with one voice. It is time to have a mask mandate. And I don't care if you're a Democrat or a Republican, a mask is not a political statement, is not a partisan statement. A mask is a public health intervention. We need to respect social distancing, stay 6 feet apart. We need to wash our hands. But most importantly, we also need to avoid crowding places. And there was a recent study showed that most infections are linked to people being at restaurants, being at bars, being at gyms, being at religious events, and being at hotels. So there's certain places that need to be closed, or we need to significantly, drastically cut the number of people that they can serve in order to decrease transmission.
Okay, we will go ahead and start taking questions right now. Let's go to our first question. Recent reports from the White House Coronavirus Task Force show that diagnostic testing has dropped considerably in Georgia. Should that make us uncertain about figures from the Georgia Department of Public Health, especially their case counts? What is going wrong that's led to the testing deadline?
I think that testing is gone down a bit in the state, but is not yet in concerning levels. I think we need to be sure that people access testing. And I can tell you that I had somebody I sent for testing today, and they got tested. So testing is available. Testing needs to be accessed. What we need is to test more people and create demand for testing. I think testing is a critical component of identifying who's infected and isolating them and preventing the chain of transmission.
Great. Let's go on to, you called for a mask mandate. Should that be for the state, for the country?
I think at this point in time, the way we are at a country, it will be really nice to have it at the country level. That's not my role to make decisions for the country, but it'll be really clear that if we have the president, if we have the Speaker of the House, if we have the leader of the Senate, called for a national mask mandate, I think would be very important. But I also think that we need to have that, at the local level, at the level of the governor, at the level of the city. I think we really need to take this seriously. I think it's no time to continue saying, oh, we don't need this. The numbers clearly show us that we have to do something.
Next question. On a state level, Governor Kemp has recently been renewing the same provisions in his emergency orders for Georgia. What is your opinion of those? Should he make any changes, or are those enough?
Well, I think he's made some strong recommendations and some things that are helping, but I think there are others that are not helping. I still see, restaurants fairly full. I see bars not being closed, and I really think that we need to start limiting attendance to many of those places, because we have a sort of a disjoint, right? The city says no more than 50 individuals at a facility. The governor says no more than 200 or 300. So there's a difference there. And I think limiting the number of people at places, decreasing the number of people that are in close environments is going to be critical in controlling the spread of this virus.
Next question, the numbers of people traveling for the holidays has increased dramatically, yet officials are advising people to cancel traditional Thanksgiving celebrations. How should people proceed?
I think you need to proceed in a very careful way. I'm going to tell you what I'm going to do. I'm going to be traveling to New York to see my daughter, who recently had a baby. And we are doing everything possible to stay safe. My wife and I got tested yesterday. Our test results came back negative. We're going to get on a plane tomorrow. We will be wearing a face mask, and we were going to wearing eye protection when we are in the plane. We're going to have our Purell. We've done several flights. And then we're going to get to New York. We're staying at an Airbnb, and that is only our place. We're not staying at a hotel, and close to my daughter's apartment. And she and her husband have been isolated. They're also tested negative. And when they come back from the hospital, we're going to be seeing them. But before we see them, we're going to be wearing masks, and we're going to go also get tested in New York probably next Tuesday. And once we're all negative, then we'll get together and be able to be together. And we're going to limit the number of people that could come into contact with us. So creating your own bubble, it's a safe place to do it. But you have to be proactive about it. This is not a normal Thanksgiving.
Does a lack of contact tracing make it harder to pinpoint the places where people are being exposed? And if you can't say for sure where people are being infected, doesn't that make mandates and shutdowns less politically palatable?
Well, again, contact tracing is critically important. And I wish we were doing contact tracing much better than we are. Because if you do contact tracing, you can prevent the chains of transmission. And that, to me, is a critical component. You stop transmission from, remember this virus, one person infects 2.5 people. And at the end, those 2.5 people infect each one of them another 2.5 to 3 people, and on and on and on. At the end of 1 month, you have 400 people infected from one individual. If you're able to break that chain of transmission, then you decrease the number of people infected down the line. So contact tracing is critically important. There's absolutely no doubt about that. And we don't need, it's not that important in the contact tracing to say, well, it was this place or that place, and therefore we need to shut it down. Look, it's pretty clear. A lot of people are getting infected when they're in restaurants and bars. So we need to be sure that we decrease the number of people there, and that we, limit attendance. And if the space is too small, if the space is not well ventilated, we need to close it.
Okay. What do you fear will happen if we continue in the direction we're heading without a mask mandate?
Well, different predictions say that by end of February, there will be over 385,000 Americans dead. So far, there are 225,000. So we will be seeing over 100,000 deaths in the next several weeks. That is too many.
Where does the city of Atlanta stand with COVID cases right now? What concerns do you have statewide for hospitalizations and deaths?
I don't have the numbers off the top of my head in the city of Atlanta. I would tell you that at the state level, the cities in the city of Atlanta in particular are doing better than rural counties. The epidemic is growing faster in many of the rural counties, but simply because Atlanta has more people, there may be more cases in Fulton and DeKalb. Statewide, we're seeing an increase in hospitalizations, no different than what they're seeing in the rest of the country. But we are seeing not as a rapid increase as we're seeing in other places. I mean, I'm talking to colleagues in Nebraska, I'm talking to colleagues in Wisconsin and Utah. They're really struggling. Their hospitals are at capacity.
Governor Kemp said yesterday, while we're grateful Georgia is not currently seeing the challenges with COVID that other states across the country are, we have to continue to remain vigilant every day. Are you concerned by that type of messaging, which appears to emphasize a rosier picture for Georgia compared to other states? What should the governor be saying instead to bring more of a sense of urgency?
I actually think that's a really good message. We need to tell people, continue doing what we're doing or do a little more. But I think that's actually a good message. We need to encourage people. We cannot continue telling people you're not doing, what you're doing is not working. I think what we've been doing in Georgia is working, but we need to not let the guard down. We need to continue doing it. And again, emphasize the fact that, more masking, more social distancing, more avoiding crowded places is going to keep our cases down in Georgia. That's okay.
Under Governor Kemp's orders, there have been large gatherings of hundreds of people. However, his orders do prohibit gatherings of 50 people or more. Should there be a change in government enforcement of the protective orders?
I mean, I think so. I think we need to avoid, I think gatherings of more than 50 people in closed environments are not going to work, are going to be problematic, and they're going to be super spreading events. We really need to avoid those. And if they're not prohibited, I would encourage people not to attend them. I mean, if I was invited today to a party with, 100 people, I would politely say, I'm sorry, but I'm not doing that.
What do you say to those who put the pandemic into a choice of keeping open the economy or slowing the spread of the virus?
Well, this is a false dichotomy. It's not the economy versus public health. If we slow the spread of the virus, we will be able to open the economy more. South Korea is an excellent example of that. South Korea never locked the economy, but South Korea, by doing aggressive testing, contact tracing, isolation and quarantining, and by having universal masking, has actually been able to keep their economy open. So, in fact, public health will be the key to keep the economy open. Is not public health versus the economy.
How confident are you with traveling by plane when some airlines have now resumed booking flights at full capacity?
I'm pretty confident for a variety of reasons. I'm confident because pretty much all the airlines, all the U.S. carriers have upgraded their ventilation system. Their number of air exchanges has increased dramatically. They have better filtration in place. They also have, made mask requirements. And I personally, they have cleaned, they're ionizing the cabins. They're really doing a lot of deep cleaning into the cabins. I think that I also personally take eye protection. I've taken over 10 flights since the pandemic started. I feel confident. I do think that you have to be careful, and it's not your typical flight. I don't take my mask off. I don't take a snack during the plane. I've been pretty careful about doing it, but you have to be very intentional, and you have to be very careful.
How reliable are the conclusions of the recent Nature study that traced mobile phones to locations and used it to conclude which communities or locations are most at risk?
I think it's a very good study. I was very impressed by that study. And again, I invite you to look at that study. That study essentially shows that most infections are happening because people are concentrating in restaurants, in bars, in gymnasiums, in religious places of worship, and in hotels.
How concerned are you about shortages in COVID-19 medications given the surge in cases? Can you talk to us about the state of the COVID vaccine as well as the antibody treatments that Emory is involved with?
Yes, I think, I'm more concerned about not having enough capacity in hospitals as far as beds, as far as ICU capacity, and about not having enough healthcare workers. Searches are about what I call space, stuff, and staff. And space we can create, stuff we can buy, but staff we cannot make up. So I worry about our nurses, I worry about our healthcare providers, I worry about simply not having enough of them. But I also worry about the availability of medications. I would say that through research, treatment of COVID has improved dramatically, and the mortality as a result has decreased significantly. Two things worth mentioning is this week we had the FDA issue an emergency use authorization by a monoclonal antibody produced by Lilly. The antibody is called bamlanivimab, and this is a drug that can be given to outpatients with mild to moderate COVID. And this is great because we never had a drug to give people who are outpatient, who are outside the hospital, who don't require hospitalization. And what this study showed is that by giving this antibody, you decrease their viral load and you decrease the risk of them becoming hospitalized. So we are beginning to use this in the treatment, but we're also continuing doing research. We're doing a study here called Active-2, in which we're actually testing this treatment. The second thing is obviously the vaccine news. The vaccine news, I think it's quite frankly very exciting. It's very encouraging. We're all looking forward to see the actual data because at this point in time, all we have is a press release. And again, this was an interim analysis. This is not the final analysis. But having said that, even if everything goes well, there won't be a vaccine available to the general public until maybe April or May of next year. That is too late. We need to pretend that there's not a vaccine right now because there isn't. And we need to mask, we need to social distance, and we need to protect ourselves because the vaccine right now is called a face mask.
What would be your advice to President-elect Biden when he takes office in January?
Well, I think President-elect Biden has an excellent group of advisors working with him. I have a lot of respect for the 13 people appointed to his coronavirus task force. My main advice is not to ditch everything that has been done so far. I would say, tell you that the coronavirus weekly report to the governors that the coronavirus task force is producing right now are excellent. I would make those reports available to the public, freely available. I would make them open so people read them and they read what their governors are being told. And I would make the governors then follow those recommendations because I think if every governor was following the coronavirus task force reports, we would be in a very different place right now. Susan?
Apologize, I was on mute. What would you say to Jordans who see that the state is not doing as badly as the rest of the country now and feel that we're at a sort of entropy? Our hospitals are okay and the system is handling the level of sickness. For those people who don't feel a sense of urgency to change current behavior, what would you say to them?
Well, I would tell you, I mean, the analogy I tell people is to say, we don't need to take precautions because the hospitals still have capacity would be equivalent to me saying, well, we don't need to respect the speed limits in the freeway because there's enough capacity in the hospital to take care of us if we have an accident. That would not be the way we would behave. But imagine if all of a sudden you had big signs out there saying, speed limits not enforced this week because we have enough bed capacity in hospitals. That would be kind of ridiculous, right? Well, that's exactly what we're seeing. You don't want to end up in the hospital, trust me.
Would you please speak to where we stand on the vaccine development and production and what Georgians should reasonably expect in terms of a timeline for having access to a vaccine, both for the most vulnerable positions and for the public at large?
I think, the first thing that's going to happen is the company Pfizer and then other companies maybe are going to have to show their data to the FDA. They're going to have to request, the FDA will probably issue an emergency use authorization, suspect sometime in December. Maybe in January, we will start having vaccine. Pfizer says it currently has vaccine for about 30 million doses. Given the fact that you need 2 doses of vaccine, that's 15 million Americans that could be immunized. We have 350 million Americans that need to be immunized. So it's going to take us some time to get there. The recommendations is that we look at tiers. So we start by immunizing first respondents, then people at high risk, for example, people living in nursing homes with a lot of comorbidities, and shortly thereafter start moving through different phases to the school children, the teachers, the general population. Getting to general population is going to take some time. As I said before, I don't think it's going to happen before, July or August when we get there. Now, having said that, it is very important that we remember that this vaccine is a vaccine, at least the Pfizer vaccine, is a vaccine that requires 2 doses, and it requires refrigeration at minus 80 degrees Celsius. that is not your common freezer. That is actually a very specific, highly technical and expensive refrigeration. So what we're going to see here is likely not us being able to take the vaccine to the people, but actually having to have the people go to certain specific sites to get the vaccine.
Do you expect Georgia to see another surge in cases or infections after the Thanksgiving and other coming holidays?
We're already seeing a surge right now. I think it's going to get worse after the holidays if we don't do the right things. The surge is already happening.
Public health messaging has obviously been important, but not sufficient, especially because of the politicization. It is time to change the messaging, perhaps make it more aggressive along the lines of anti-smoking messages that showed people with tracheotomy tubes or rotting jaws.
You know, the research in HIV has shown that doesn't work. You get people to change behavior primarily by having by changing community norms, by making the way we got smoking to really decrease significantly is because we said you can't smoke in restaurants, and we made it a community norm that smoking was wrong, that smoking was not okay. So yes, rules are important, but community norms are more important. So I would say that we need to, for example, emphasize the need for masking, but at the same time, emphasize the need that all of us need to do something to prevent the transmission of this virus.
And as a follow-up to your op-ed in today's AJC, we have a couple questions about what your advice would be, specific advice would be for the CDC.
Well, I think the CDC has some of the best and the brightest scientists to confront this pandemic. And many of them are my friends, my colleagues, and I would call on CDC leadership to get the experts out there, to get them in the media, to have frequent press briefings, and to get them to explain what they're doing. CDC has been issuing some very good technical guidelines lately. Recently, a couple of days ago, they issued one saying that masking not only protects others, if you wear a mask, not only protects others, but it actually protects you. Well, we need somebody out there explaining what is the science behind it. What have we learned that got us to that conclusion? So again, communicating the messaging to the people on a regular basis through the media, I think is a critical thing that CDC has to do right now.
What about nursing homes? Do you think they are better protected now than they were in the spring? What do you think needs to be done?
I think they're better protected now, but I think nursing homes still have a challenge. And the major challenge that nursing homes have is that the people that work in nursing homes go in and out. And frequently the people that work in nursing homes are low-paid individuals who have multiple jobs and therefore frequently may get infected and may bring the infection into the nursing home. So we need to continue to regularly test nursing home residents and also test the employees. And in that respect, when we talk about the vaccine, the recommendations on the vaccine allocation that were done by the National Academy of Science, Engineering, and Medicine and co-chaired by Drs. Bill Foege and Helene Gale said, when you go and vaccinate the vulnerable in a nursing home, you also have to vaccinate the employees at the nursing home. And I think that's spot on.
Going back to mask mandate question, ideally, how would you recommend enforcing a mask mandate?
Again, I'm not a lawyer. That's for legislators to make the decision how they're going to enforce it. But there's ways that a business can enforce it. Business, and I've seen many businesses say you cannot come in if you're not wearing a mask. I think that will be really nice to have the FAA issue a mandate to have if you wear a face mask on airplanes, and that way you wouldn't have the flight crew trying to enforce something and people saying, well, that's not the law. I mean, there's certain things that could happen at the federal and at the legislative level that will allow mandates to be, and that will allow enforcement to occur easily.
Are you confident that Georgia has the public health infrastructure to get vaccine to the majority of the population safely and effectively? Does the state have important resources like the appropriate cold storage?
I don't know the answer to that, and I think those are very good questions for Dr. Kathleen Toomey. Rolling out this vaccine is not going to be easy. But can we do it? You know, if anybody can do it, I think our country can do it. I'm more concerned about developing countries. But is it going to be easy to get this vaccine to rural communities? Absolutely not. It's going to be hard.
Okay, we're going to go ahead and wrap up there. Everyone, thank you very much for your questions. Dr. Del Rio, do you have any final words?
I mean, my final words is that the holidays are coming and that we need to be careful. And I would encourage, my advice to everybody is don't get infected. You don't want to be a patient in the hospital. You don't want to end up in an ICU. You don't want to end up dead. So please wear a mask, protect yourselves, and set up a good example.
Okay, great. Thank you very much, Dr. Del Rio. Once again, thank you everyone for joining. As a reminder, if you have any follow-up questions, go ahead and send those to Catherine Morrow. You all have her contact information, and when we will get connected with Dr. Del Rio to get them answered. Otherwise, the recording of this briefing will be distributed within the next 10 minutes following its conclusion. Thank you, everyone. Have a great day.
Thanks, everybody.